Hey guys, it's Dave. Today we're going to talk about something that is common for a lot of people, especially as we get older and you've been in the workforce doing the same thing for a number of years, and that is carpal tunnel syndrome. Carpal tunnel syndrome was actually named after the passageway in which the median nerve goes through your wrist, and it goes through the carpal tunnel or that passageway. And what it can happen is you can get a pinching, a bending, or a cramp down on that nerve, or even the passageway can become narrow in which you have pressure put upon that nerve. And it causes tingling, pain, shooting, like mini shocks that can occur in mainly the finger, the forefinger and the thumb, but it can affect all the fingers, and it can shoot up into the forearm. You can also see what they call clumsiness, where you're just not able to handle things like you at one time were able to handle them, and also weakness. So you might pick up a glass that you've picked up for years and just not have the strength to grip it and hold it, and it will fall. Several causes can actually lead to carpal tunnel syndrome, one of which was kind of surprising. It can be hereditary. If you have one parent, you are more likely to have it. If you have two, you're really going to be prone to actually having it. And in that situation, what's happening is it's actually probably due to the size of the carpal tunnel itself within the wrist, because you have small bones, because your parents had small bones. Therefore, your median nerve is going to have to fit through a smaller tunnel than somebody else. So that falls in line with the hereditary aspect of it. Something else that definitely will cause it is repetitive hand use, and especially doing the same thing over and over every day, day after day. So if you're at the keyboard, you're typing every day, that's something that would cause that, as well as doing things like in a factory. If you're doing something over and over again every day without breaks in between and not breaking up your hand positioning, you're going to be prone to it. Also, if you're going through menopause or you're pregnant, due to fluid retention and buildup, which can cause pressure on the median nerve, you can be prone to it. But as you go through your pregnancy, that will go away, as well as with menopause. Hopefully that can go away too. But there are some things later on we'll talk about that can help with that. Hand and wrist positioning, that is a big issue. And I have a friend who's a chiropractor, and he would be on me all the time because I would use my mouse in the pharmacy all the time. And he'd say, no, you've got to change up. You've got to use the keyboard, then use the mouse, go back and forth. So make sure during the day that you're repositioning not only your fingers, your hand, but your wrist as well. Because if you don't change the positioning of your hands, you're going to be more prone to it. And then there is a rare occasion where it does occur, but a cyst or a tumor can also cause it as well, which is why if it doesn't go away, you definitely need to get in and see your provider to discuss some options and see if it's something more serious than just carpal tunnel syndrome. What are some risk factors that can actually lead to it? Well, number one, are you taking breaks during the day? A lot of people can't get away from doing what they do for a living or doing what they do just to enjoy as a hobby. I used to love baseball cards. Guess what? You're sorting through those babies. You're doing the same hand motion. Your wrists are in the same position as you're doing it. You need to take breaks. Give your wrist, give your fingers, give your hand a break from what you're doing, whether it be getting up, walking around, or just, like I said, I would go from the mouse to the keyboard to break that up. Something else, if you're a female, like I discussed with the menopause and pregnancy, you're more likely to get carpal tunnel syndrome. If you have diabetes due to the nerve damage, it won't actually maybe be to the carpal tunnel itself, but to the damage to the median nerve, you're more likely to have it. If you have thyroid issues or rheumatoid arthritis, and the reason they believe those two fall in line with that is because with the thyroid, it's an autoimmune disease which can cause inflammation, as well as rheumatoid arthritis causing inflammation, which can cause pressure on the median nerve itself, leading to carpal tunnel. If you're on the cancer drug anastrozole, that one can, for some reason, cause carpal tunnel syndrome. So if you're noticing you're getting those tingling sensations, the shooting, the pain in the hand, the wrist, the forearm, the fingers, and you're on that medication, talk to your general provider or your oncologist about maybe looking at another one. Obesity, mainly again because of pressure that's put on your body because of being obese, you will be more prone to carpal tunnel, as well as people who deal with fluid retention. So if you're having on your feet a lot, you see a lot of retention. If you have congestive heart failure, that can also lead to carpal tunnel syndrome. So you really want to watch out for that. Now, what can you do to treat it? Well, one thing that's easy to do that I highly recommend is physical therapy or occupational therapy. If you go in to check those people out, they do a lot of different exercises, a lot of different tips and tricks to help you so you can get away with the things that are causing the pain and the shooting and the inflammation. A chiropractor is another good person to see. In fact, that's what I discussed earlier. That's where I went when I started having that issue. I never did develop carpal tunnel syndrome. He was able to help me out, give me some tips and tricks, and get me adjusted. Then you can look at, as far as over-the-counter, some NSAIDs like ibuprofen or Aleve or naproxen. Remember with that, it does increase your bleeding risk. It also can affect your stomach. So you want to only use that for a short term. If you have any cardiac issues, heart issues, I want you to talk to your provider before you use those. BioFreeze or like Blue Emu creams and ointments are another good alternative that will give you some relief. Apply it to both sides of the wrist and really rub it in really well. Usually you can do it 2 to 3 times a day and you would be fine. Like I said earlier, changing hand positions is something that will definitely help you out, as well as exercising your wrists. They make the grab balls that you can get to strengthen your wrist. It also gives you a different angle on your wrist and your hand as well. And you can get just a tennis ball and squeeze a tennis ball several times as you're sitting watching TV, or even if you're able to at work. Sometimes you can do it. It's a great stress relief as well, but it's a good hand exercise and forearm exercise in there. Another treatment that they can do is a steroid injection. Now remember, that's not a cure-all to end-all. There are some side effects with it. It can decrease your immune system, make it not as powerful. You want to be aware of that. And a steroid injection in some people may only last about 4 weeks, but in other people, it's been known to last up to 5 to 6 months. All depends on your metabolism, all depends on your situation. But they're not recommended in younger people, and they're not recommended for over a long period of time. So you want to talk to your general provider about that as well. Worst case scenario, of course, there is surgery. We have come a long way in carpal tunnel surgery. I remember when it first came out, literally about 50% of the time it would work, about 50% of the time it would not, and sometimes when it would not work, it was worse than it was before. But that was a long time ago. Surgeons and doctors now know so much better ways to do surgery and to treat carpal tunnel. I've had a lot of patients that have had very good success with minimal side effects afterwards and getting off a lot of pain medications and things like that. So that is the final option, but we are in a lot better place with that. Find yourself a good surgeon, discuss your options with that. Don't be as near afraid as you were like even 10 years ago. The earlier you catch it, the better and more successful the outcome is. So if you're starting to feel that pain, if you're starting to notice your grip is not as good as it once was, you're getting the shooting in there, you're clumsy with your hands, get in to see your doctor, get in to see a chiropractor, a physical therapist, or an occupational therapist. Easy tips that you can just do at home that's not going to require a doctor or anything like that. First, reduce the force of your grip. Loosen your grip up a little bit. You don't want to drop that glass, but you can loosen your grip, and that will help out. Secondly, make sure you're taking a lot of breaks, like I said, throughout the day. That's very important to not do the same thing over and over without breaks. If you are on a keyboard, adjust the height of your chair or the keyboard height And you can also get the keyboard lifters so you can adjust the angle of the keyboard that you're at. That will help out. And also use hotkeys instead of the mouse. So if you can use like the F1 through F12, do that instead of the mouse, and then alternate and use the mouse sometimes so you're moving. Stretch before you go into work or your hobby, whatever may cause the repetitive motion. Do some finger stretches, do some wrist stretches, get things loosened up. Also keep your hands and wrists warm. The warmer they are, the more the blood flow will help, and that will also help as far as the repetitive movements. And then if you can elevate your hands and your wrists, so you're not sitting at your keyboard with your hands down below, typing down here, get them up. That elevation will help the angle and help as far as with preventing carpal tunnel. The most important thing is you catch it early. So if you're noticing you're clumsy, if you're noticing you're not able to grip something as well as you once were, you're not able to hold on to that cup that you always had without difficulty, if you're feeling some shooting pains going in your forearm, down your fingers, if you're feeling the tingling sensation I mentioned before, get in right away to see your general provider or your physical therapist, occupational therapist, or your chiropractor. Because the sooner you get on it, the better the outcomes in the end. But it's very important you get on it right away so your outcome will be better and you can get a different treatment going so you don't do more damage to that median nerve that may end up just being able to have surgery in the long run instead of something else a little minor.